Have you been told you're getting a late enrollment penalty on your Part D drug plan? Hi, my name is Christopher Westfall. We have thousands of clients from coast to coast. We help exclusively with Medicare, and this tends to be the topic of late. Many people have just signed up for their Part D drug plan for the first time ever, and they've received from Medicare a letter saying that due to your late enrollment penalty, your monthly premium that you thought you signed up for will actually be sometimes significantly higher. Well, how can that be? So many of our clients have come from creditable coverage, meaning they worked past the age of 65, working for a large employer group where their coverage was considered creditable as it was the same or better than Medicare's Part D drug plan. So later, they decided to retire and they picked up a Part D drug plan through the Medicare system. So they had creditable coverage, but for some reason, this information was not transmitted over to Medicare, and Medicare has relayed to their Part D carrier that they now owe this penalty. Well, how do you go around that? See, it's quite confusing when you sign up for Medicare past the age of 65, because in order to start Part B, B as in boy, of Medicare, that's the outpatient side, you have to get your current or former employer to sign off on the fact that you've had creditable coverage the entire time since you'd turned 65. So that information goes over to Social Security, and they get you signed up for Medicare, Part A and Part B. The challenge is that Part D, the drug plan, is done by Medicare and has nothing to do with the Part B that was done by Social Security. As a matter of fact, that employer signed form that got you onto Part B of Medicare with a special enrollment period that you can start now, even though it's not that time of the year, even though you're not just now turning 65, that exception that your employer signed off on does not in any way go toward your Medicare record, other than for the simple fact of starting you on the Part B of Medicare. So when you sign up for a drug plan, and again, you're not turning 65, you're not in your initial coverage election period because of turning 65 onto Medicare, what happens is the drug plan company has nothing to go by. So they submit that information over to Medicare. Medicare says we have nothing to go by because the information does not come from Social Security. It's like these two federal entities just can't talk to each other, which is still amazing. So in some of the cases, not even all the cases, but in some cases, Medicare will tell the carrier to reach out to you and say, prove it that you had prior coverage. So the best way to do that is not with the old letter from Part B. That does not satisfy it. The best part is to get a certificate of creditable coverage from your former employer's insurance company. So you can try getting a letter from the employer saying you were covered from this date to this time, but what they're supposed to do is at the end of every coverage year, send you a certificate of creditable coverage saying that from this time frame to this time frame, you had adequate creditable coverage. And it's supposed to even specify whether it was good for Medicare or not. So you can take this certificate of creditable coverage that you should be able to get from your employer or their group plan and submit that in a timely manner, and that's critical. You've got to get it back within the window of time that they're asking for it from your drug plan company. And then I would follow up one step further, make sure that they got that information over to Medicare. So what happens if you submitted all this information, you were the one selected out for scrutiny, kind of like at TSA getting on an airplane, they pull you out and they say, we want you to give us proof that you were in fact leaving an employer or group coverage. And so you give this coverage to them, and then Medicare says, you know what, we didn't even get it, we don't know what you're talking about, you're going to have to pay the penalty for life. There is an appeal method. As a matter of fact, it's called Request for Reconsideration. Now, this is the same thing that applies to those folks affected by IRMAA, I-R-M-A-A. IRMAA is where you're getting an income-related Medicare adjustment amount. So that's where they increase the price of your Part D drug plan, or they increase the part of your Part B outpatient part to Medicare just simply because you earned too much money 2 years ago. Now, both for IRMAA and for the late enrollment penalty, there are two separate tracks, but they're still called the same thing. It's a request for reconsideration. Below this video, we'll put the links for both. And now, on the late enrollment penalty with the drug plans, Medicare has assigned one private organization the job of going through these appeals, the request for reconsideration, and making a determination as to whether or not you should be assessed this penalty for life. So don't hold it against your insurance agent, because we cannot see what your record is with Medicare. We can't see that Medicare has you with enough credits to retire, enough credits to take Medicare. We can't see any of that. And to the extent that you did have creditable coverage and maybe we even helped you get onto Part B, still Medicare does not have that information until you alone can provide that to Medicare for that request for reconsideration. So hopefully it can all be solved within the time frame that they've sent you that letter. Sometimes we have people that are traveling in RVs all around the country all the time, and they may not get that letter in a timely manner. That can be a tragedy. So again, you'll have to request for a manual reconsideration if you did not get that proof to them in time to make that late enrollment penalty go away. So see the links below, and you can research how you can submit for a request for reconsideration, and hopefully they'll see it your way. And the late enrollment penalty, which on the Part D drug plan otherwise would follow you for the rest of your days and always be added to whatever the market price is for the premium of the Part D drug plan. It would always be the premium plus that amount. So if you can get rid of it because you did have creditable coverage from the time you were first eligible for Medicare until the time that you decided to take the drug plan, then by all means, move heaven and earth if you can to get that certificate of creditable coverage or the proof that you were covered for that period of time, and get that to the plan provider so that they can tell Medicare that you are not going to get that penalty. That's the best thing you can possibly do. I'm Christopher Westfall with Senior Savings Network. Make sure to subscribe to our channel down here, and if you wouldn't mind, do me a favor, hit the like button down there. It kind of helps YouTube understand that these are videos that are actually helping people and giving them resources, which is all we try to do. If we can help you with your Medicare Supplement plan, please reach out to us anytime at the toll-free number listed here. Thank you so much. Bye-bye.